The teenage years are wonderful years. They're a time of exploration. They're a time when kids' personalities really flourish and they find new interests. And yet it's also a difficult time. It's a time when it can be difficult to keep the risks associated with the teen years in check. One of those risks is substance use. Teens are so exploratory that it's those teen years that they often try substances, and sometimes those substances start to become problems. As a parent, it can be hard to know what to do. Is a little bit of experimentation a bad thing? What happens if regular use starts to occur? At Plan Your Recovery, we can help you answer those questions. We love working with teens and we love working with their families. I will say at the get-go, if your teen is starting to use substances, you probably want to intervene. While recreational use may not be a problem developmentally over time, it's a really good time to start addressing a potential issue. There are certain teen characteristics that make a teen much more liable to develop addiction than other teens. Those four traits two of them are what we call internalizing traits. Teens that have a sense of hopelessness, which is a severe symptom of depression. When they find drugs and alcohol, often find that regular use makes them feel better. Of course, regular use also leads to addiction and causes significant problems in their functioning. Also, a child who has anxiety sensitivity, that doesn't mean that they just have anxiety or stress, but they're very sensitive to the symptoms of anxiety. Those teens, when they discover drugs or alcohol, often find a relief that just feels so good to them that they end up using more regularly than the average person who's experimenting with substance use. The two other traits are externalizing. They're impulsivity and sensation seeking. Obviously, a teen that has a trait of impulsivity is making decisions too quickly, going out and trying to do the fun thing without thinking. When you engage in behavior without thinking, oftentimes you'll do riskier things such as use substances. And so kids that are impulsive will often use substances more and more readily than a kid who's more risk averse or a little bit more thoughtful about their behavior. And then finally, sensation seeking. A lot of kids, for instance, with attention deficit hyperactivity disorder, are always seeking a sensation that will hold their attention. Well, drugs and alcohol hold their attention, and it can be a way of self-medicating that attention deficit or hyperactivity, that sensation seeking, that keeps someone with ADHD using more readily, more often than the average teen. You may sort of hear a theme here. If there were one clinical goal in adolescence, it would be preventing the onset of regular use. Teens are going to experiment to some extent, but once they start using regularly, it becomes part of the way they cope with their emotions. It starts to affect things like their academics, their relationships, and it impacts development at a very sensitive developmental period where teens are learning how to cope with stress, how to think in school, how to negotiate different kinds of more complex relationships, and addictive problems can really impact all those areas of development. The core of our program, the core of our approach to addressing substance use disorder in teens is the family. We use a contingency management approach with a very specific aim. When a kid starts to develop an addiction to a substance or starts to just use more regularly and develop a stronger relationship with the substance or addictive behavior like video game playing, their motivational landscape becomes organized around that behavior, around that substance. Our goal is to reorganize that motivational landscape through restructuring the rewards and consequences associated with their daily lives. We always tell the teens when they come into our program our goal is to make your life more rewarding when you're not using substances than it is when you're using substances. Now, there can be a difficult emotional transition when you're kind of moving from one motivational landscape to another, but we really take a lot of pride in helping parents and families with the art of structuring a contingency management plan, the measurement, the goals, the rewards, the consequences that help create a scaffolding and help a teen to separate from problematic substance use. When they do, it's amazing to see how much happier teens actually become when they get that freedom. Of course, at the beginning, teens are often refused treatment, they're oppositional, but those behaviors and those responses really change when parents are able to take a kind of this calm, caring authority in the teen's life, restructure their motivational landscape, and help them with contingency management. I'll tell you what, when I started doing contingency management or read about it, I didn't really believe it. I thought, how would you really help a teen to change such a difficult behavior like substance use? And yet, with the families that we've worked with, we've seen such great results, so much happiness in the parents and in the teens, and such an improvement in relationship. It really has become one of the core parts of our addiction treatment program at Plan Your Recovery, and one of the things that we enjoy the most. With teens, we don't only need to focus on getting rid of substance use. We also need to help them be successful in their lives. And so if a teen is struggling in school or is having difficulty with a co-occurring mental health condition, we try to provide all those supports, tutoring. We work with child and adolescent psychiatrists in case the student needs medication, cognitive behavioral therapy to address anxiety and depression. We really want to help not just the separation from the substance, to facilitate not just the separation from the substance, but to facilitate the success of the teen. And we collaborate closely with the parents on trying to achieve that goal. If you would like to consider Plan Your Recovery, there's no commitment. All we do is sit down, talk about what your family needs, talk about the problem that you are observing in your teen, and we can start to consider what are the options for helping your teen make the changes that you think are important for them at this developmental stage in their lives. You can give us a call at 314-467-8393 or send us an email on our website.